My name is Arielle Seidler, and I'm the family therapist here at Maryland Addiction Recovery Center. I started working for MARC in 2015 as a primary therapist, and after about 4 years, we at MARC realized that a huge part of the MARC philosophy, which is that addiction is a family disease, was not getting the support it really needed. As a result of that, we decided to develop the Family Recovery Program. What that looks like is once a family and a patient is admitted to MARC, we immediately engage the patient and assess their needs to make sure they're getting the appropriate and necessary support to manage their addiction, mental health struggles, trauma, and medical issues. But we're also looking at the family members to make sure they're getting the support that they need. A lot of times, family members will ask our clinical team or their loved one's primary therapist what they can best do to support their loved ones who are here for treatment. And a huge part of that process that we explain to them is that they really need to do their own work to develop their own healing process. So what that looks like is making sure that they're really addressing how addiction has affected them and what they need to do to make sure that they're feeling like they're supported in making changes in their own lives and in the ways that they're interacting with their addicted loved one. A really big part of that is for them to engage in their own therapy outside of MARC, going to Al-Anon or Nar-Anon or other family support groups, but it also includes them being part of the process here at MARC, which means attending ongoing family therapy sessions with their loved one and attending our full family recovery program. What that program looks like is we have about 4 to 5 families who come together as a cohort. They engage in different Zoom sessions where we talk about things like addiction, recovery, relapse, not just for the patients, but for the families as well, so that they can fully understand what it means for them to be on their own recovery journeys, independent of their loved one's recovery journey. We also talk about family dynamics and things like enabling and codependency to really help empower family members to start making changes in their own lives. Once those calls are completed, we have those family members in that small group of families come in for a long weekend of intensive therapeutic experiences, where we have them listen to alumni family members talk about their recovery journey, and we engage them in multifamily group therapy processes, where we do process groups, experiential groups, sometimes with their loved ones and sometimes with only the family members. Again, the point is to really focus and support them on their own recovery journey process. We understand that as loved ones of someone struggling with addiction, the family members have experienced a tremendous amount of trauma and fear, anger and anxiety, and sadness about what is happening with their loved one. And because they're experiencing such a wide range of emotions, it will directly affect not only how they're feeling, but how they're interacting with their loved one, how they're interacting with the rest of their family members, and it takes a huge impact on how they're going to support their loved one as their loved one is moving forward in a recovery environment. It's crucial that family members are able to really address the trauma that they've experienced and the wide range of emotions that they're feeling around this so that they are able to heal, and in doing so, start changing how they interact with people around them and how they interact with themselves. As they start to heal and grow, we find that the way that those interactions happen and the connections that they make with people in their lives will have an overall effect on their relationships in which they will start to flourish, and the way that they communicate will change dramatically, and they're going to be able to have a much more meaningful experience with their loved ones as they move forward together as a family in recovery.